Hello, welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. Aaron Guest. To introduce Dr. Aaron Guest, his career and achievements might require a very long introduction. However, I will share just a few highlights of his remarkable journey. Dr. Aaron Guest is a socio-environmental gerontologist who currently holds the position of assistant professor of aging within the Center for Innovation in Healthy and Resilient Aging at the Edson College of Nursing and Health Innovation at Arizona State University. He is also an active member of APHA and currently serves as the Speaker of the Governing Council. He plays a vital role as the chair of the LGBTQ Health Caucus, where he leads and guides initiatives aimed at addressing health disparities and promoting equity with the LGBTQ community. He is a dedicated worker of public health, understanding the social experiences of marginalized aging individuals in rural areas and urban centers, with a special emphasis on working with LGBTQ populations to reduce health disparities and inequities. So welcome, Dr. Aaron Guest.
Thank you.
You are an active member of the APHA since 2012.
Yes.
How did you become involved with APHA and what motivated you to serve in various positions with the organization?
Yeah, so I became a member of APHA actually after joining my local state affiliate. So I joined the South Carolina Public Health Association during my time as a student at the University of South Carolina. And as I kind of got involved with that and was talking to my mentors, they're like, well, there's a national version of this. So it was kind of one of those unique things where it's like, well, what is this American Public Health Association? How do I learn more? And my mentors were saying, well, you need to at least go to it. You need to join. You need to learn more about it. And I'm one of those people that if I join something, I want to be involved in it in some way. I want to be active. And so it was really kind of through the help of my mentors, individuals like Danielle Friedman, Heather Brandt, who had leadership positions with APHA, who kind of opened the door, my eyes, and opened the door to say oh, come and learn more about the association. And not only that, we have these opportunities to be involved. And so right after I joined the association, back then you would get emails from the student assembly saying, welcome. And it just so happened they had a call for a committee chair. And I was like, well, I'm kind of interested in the topic. It was diversity and equity committee chair. I was like, oh, I'll just apply. And so I was very lucky to get that opportunity. And then that as I developed in that position, I kind of learned about more opportunities. So it really just kind of grew from there.
Wonderful. Now, can you tell us more about your role as the Speaker of the Governing Council for the American Public Health Association?
Yeah, so the Speaker of the Governing Council is one of the officers of the association. The Speaker also sits on the executive board of the association. And the Speaker role, I always say it's much like the House Speaker in the sense that you oversee the Governing Council, which the Governing Council of APHA is the legislative representative body. So all the different member units, sections, caucuses, affiliates that kind of make up our membership all have representation on this body. And what this body really does is it debates things like dues increases. It helps sets the guidelines for the association, like where we will and will not have our annual meeting. And one of the most important things it does is it elects our officers of the association to the executive board, presidency, speaker, and treasurer. And it also adopts the policy statements that guide public health. So APHA has a robust policy development process, and our policy process goes back over 100 years now. Things that we take for granted now, like the standards around dairy production, the common death certificate, the actual existence of the CDC and the United States Department of Health, all have their origins in our policy process. And so over the years, the process has really served as the forefront of public health and where we're going, and has really helped set the tone for the profession.
Wow. Yeah. Sounds like it's really a very basic structure for the organization.
It is. It's really, at its core, it is the highest body in the association when it meets. When it's not in session, the executive board oversees most of the internal operations, but it does. It has the ability to amend our bylaws. It has the ability to give honorary memberships. It's in many ways you have our president, and then you have me as the legislative branch. But it's great, and it's really wonderful to have so many different voices involved in the process.
Great. It's a big responsibility.
Yeah.
Now, in your role as chair of the LGBTQ plus Health Caucus, what are some of the important initiatives or discussions taking place within the caucus?
Yeah, so we've, over our last 50 years, the caucus really started in response, much like other caucuses, to events in APHA and the history of public health. And so in 1975, when the caucus started, it was really to increase the visibility and recognition that there are LGBTQ individuals in public health. At the time, it was coming off the Red Scare, where if you identified as LGBTQ, you would be, fired from your government position. People were afraid to come out. And even though we started as the Gay Men's Public Health Caucus, we really kind of always included everyone. Over the last 10 years or so, really what we focus on have been things such as the inclusion of a gender-neutral policy at APHA for restrooms, focusing on bullying prevention. We have focused heavily on data and data inclusion, because one of the things we know is we can't understand the health of our population without having data. And then we've done things such as introducing pronoun ribbons at APHA, providing ways to engage others working in this space, and really thinking about how can we bring public health along with some of the advances. So, for example, many of our members have served in roles on the national academies to advance LGBTQ health, have looked at data issues around LGBTQ health, and really now I would say we're in this unique position of actually being able to finally expand the science to say, here's what we know, and we know this because we now have good data.
Great. Now, can you share some insights into the challenges? You mentioned a few that the LGBTQ plus caucus is facing, and also the aging community, the rural environments and non-urban areas. What are some of the projects you are involved to reduce health disparities and inequities among these communities?
No, absolutely. So most of my work is on LGBTQ aging, so I kind of combine them. I'd say, I'll take them independently, though. I think one of the challenges we have with the LGBTQ health is, one, data access. We know that, for example, LGBTQ youth are more likely to report depression and commit suicide. They're also much more likely to be homeless. And when we look at populations who, kind of an intersectional approach, when we look at LGBTQ individuals who identify as Black or African American, Latino, first generation, immigrant, those disparities increase rapidly. And so we have that. We have the challenges in middle adulthood about the development of chronic diseases, the fact that income often doesn't equal education, meaning that individuals are not getting hired into positions that they're trained for. In older adulthood, we have the fact that older LGBTQ individuals have report higher rates of loneliness. Lesbian women report higher cancer rates. Gay men report higher rates of HIV/AIDS, as well as isolation. And part of that is because we think about, we're now facing the kind of aging of the HIV/AIDS epidemic, and so we lost 400,000 people in that, and so there's not as many connections for them. We also see that family disaffiliation, where individuals don't have that support network to rely on, is a major concern. And in rural areas, when we add into things about distance to healthcare, challenges of accessing healthcare across the board, finding affirming and knowledgeable providers is a major challenge. I share that, in my own work, I've met people who say they drive 8 hours to care because they're afraid of coming out in their community. Individuals won't access PrEP or other drugs like that help prevent HIV/AIDS because they're afraid of their pharmacist knowing they're gay. In the aging community, we face, I think, what I call the challenge of the public health chasm, which is we focus a lot on youth, and then all of a sudden we kind of forget that people go into middle adulthood and older adulthood. And so one of the things we have with aging populations is just we don't have a trained workforce. So developing that workforce and developing those initiatives is really critical.
Yeah, very challenging. Now we are at the APHA 2023. What do you hope to take away from this meeting?
Yeah, so I'm always excited about the networking opportunities and to seeing old friends and colleagues. But one of the things that really excites me this year about the meeting is I think we're coming kind of, this is a large meeting. We're coming off the pandemic years, and we have a lot of great science. And I'm looking forward to learning more about some of the new development and measures of looking at BIPOC, LGBTQ, and aging. I'm looking forward to learning more about the new efforts around rural health at the CDC. And I'm really looking forward to kind of both connecting with colleagues, but also kind of seeing where the state of the science is on some of these things.
Great. Now, what advice do you have for individuals looking to pursue a career in gerontology and public health, especially those interested in the LGBTQ plus community?
Yeah, I would say that I think a lot of times people are concerned that there's not opportunities, but it's kind of the opposite. There's a lot of opportunities. I would say, be willing to kind of advocate for yourself. Look for those unique opportunities that fulfill your needs. I think it's a rich area. There's a strong, you may feel like you're alone. I know when I was going through my program, I was the only one focused on aging. But just because you may be the only one in your program looking at something, or the only one who's getting an MPH, there's a wide community out there that can support you. And so reach out beyond your university or college. Reach out beyond where you are. Connect with the national organizations. There's mentors out there. And then also I would say, if you're not challenged by, if you're able to move, there are some amazing programs in public health and beyond that focus on aging, LGBTQ health, and aging and LGBTQ health. And so we're out there. I know it's not an area that a lot of people consider when they're starting out, and that's okay, because even once you go through and get your degree, there's opportunities to advance your knowledge. And so the more the merrier.
Wonderful. Dr. Aaron Guest, thank you so much for sharing with us.
Thank you for having me.